Hello, friends. Greetings to everyone. Welcome back to the channel Pediatric Basics. If you've seen the previous video, there was on the X-ray and an ECG finding, and towards the end, there was a question about what is the most common cause of cardiac tamponade in a neonate. So the answer I will come towards the end. Let us talk about something which has been there for a while, but not many people know about it. So think about or find out whether you know about a Mart in the management of one of the conditions. Okay, so we'll go a little back to the very little basics of asthma and what is Mart in the management of asthma. What are its benefit, what are likely problems, and towards the end I'll put one another question for you all guys. When we are managing asthma, our aim is pretty much simple, and it is that there should be less than 3 times per week need for the reliever. There should be no nighttime symptoms, and as you can see on the slide that the symptoms which suggest poor asthma control are clearly mentioned there. Asthma is pretty much very simple to define, that on the background of a known or an unknown trigger, there is bronchoconstriction and there is inflammation, and that is what we need to treat. The standard therapy normally includes preventer, which is inhaled corticosteroids, plus minus there is a use of leukotriene inhibitors, and then there is a reliever which can be used in combination with the steroids, or it can be used as a separately depending on your need. So let's come to the message or the question I wanted to pass on was what is Mart? Mart is basically maintenance and reliever therapy together. It is also called as single maintenance and reliever therapy. So that's why it becomes a SMART. Basically, there is a combination of reliever as well as preventer, which is used both as a preventer therapy and it is also used as and when needed as a reliever. One important thing is the bronchodilator Formoterol is must in all this combination. Why? I'll come back to that. You probably may be knowing that Formoterol is a beta 2 agonist. That's why causing a bronchodilation as its effect. The advantage of Formoterol over all other bronchodilators within the Mart is that it has a rapid onset of action within 2 to 3 minutes, and then it is a long duration of action up to 12 hours. And that is why it is must in all the combination of the Mart regime. It is possible that in future we will have more bronchodilators with similar or better effect that may be used. So what are the recommendation for use of Mart, or when are we going to use Mart? Is that it is recommended only for children above 5 years of age, and that includes adults as well. The patient should have moderate to severe asthma, not responding to their standard therapy of preventer and reliever therapy, and it is needed basically for those who are requiring a frequent use of a reliever, and if there has been a previous significant exacerbation needing hospital admission or medical intervention. The available evidence is clearly in favor of use of Mart whenever it is recommended for and what it says that there is a better compliance. It is one simple inhaler to be used. These patients will need a clear personalized plan for their management. It helps in reduction of hospitalization and mortality. It is cost effective and also eco-friendly as you are using the metered dose inhalers for the use in Mart. Yeah, like all therapy and medication, there will be side effects, and as probably you would know that there will be side effects of bronchodilator use, and there will be side effects of the steroid use. So I'm not going to go in more details. You can probably find out a bit more about them by reading. The dosing of a Mart regime probably will vary from each patient to patient, but there will be some simple basic rules to be followed. The standard twice daily dose will be there as a maintenance and reliever therapy, but apart from that, any additional doses of the same medication can be taken up to 8 times maximum in a day, and at one time it should not be more than 6 puffs at a time. If anyone needing more than this should immediately seek a medical help. If at all you are prescribing a Mart regime, please do not forget a few things. Number one, each patient should have a clear my asthma plan or a personalized asthma plan. Number two thing, if they are needing more than 8 doses in a day, or if they're using the maximum doses and still not getting better. And then lastly, but not the least, they themselves are or the parents are worried about the children's asthma symptoms, to seek immediate medical help. I'm sure that you can easily find the various guidelines available in the management of childhood asthma and asthma, but I have just mentioned a couple of articles related to Mart regime. Please go through them when you get chance. Okay, so simple message for all of us: be Mart smart in the management of asthma. Yes, it is very useful. So, question to all the viewers. Sorry, bad habit of asking questions. What is air in the management of asthma? Yeah, I have not forgotten the question from the one of the previous video. The question was, what is the most common cause of cardiac tamponade in a neonate? And the answer is the total parental nutrition through the central line. So, thank you very much for your valuable time. And I would request, please like, please comment, and subscribe. That will probably help me to continue our journey. And I'm hoping that there will be some opportunity in future to do a live session. Thank you very much once again.